Hello, my name is Anthony Owa. I'm an ear, nose and throat consultant and neurologist based in the United Kingdom, but I do come to Nigeria often to help with cases. I've come up with a simple way of looking after yourself if you develop a COVID-19 infection using acronym Plead, P-L-E-A-D, which can be used as part of a campaign. So you could say Plead Away COVID-19. P stands for improved personal hygiene, and that includes frequent hand washing with soap and water, or the use of sanitizers, wearing masks in order to help with community protection against the virus being spread, various ways of keeping yourself clean and washing your clothes, often, especially if you come from outside in a potentially virus-infected environment. Personal space, if you do not have the facility for having a room to yourself with toilet facilities included, then you can create a space in a room if you have other occupants, but make sure there's a screen there to prevent your aerosols or your cough and saliva from getting to other people around the place. These areas should be cleaned frequently with sanitizing agents or washed frequently. And if you do need to use the toilet facilities, make sure it's a time when no one else is around and help to clean the surfaces when you finish. L for liquids. Drink as often as you can in order to keep yourself hydrated. You may well include things like sugar or glucose inside it, especially if you're not eating well. Add salt, which is an electrolyte. There used to be a combination which we use for kids with diarrhea and vomiting, and that's putting 10 teaspoons of sugar with a teaspoon of salt in a pint or 500 mils of water, and drink this often in order to try and keep yourself hydrated and also give you some energy. Alternative to this may be drinks like Lucozade. I'm not plugging it, but you can use something similar. Lemonades like 7-Up and Sprite contain a lot of sugar and fluids, and you may use this to supplement what you're doing. Eat well. Balanced diet, which will include your fruits, and if you don't think you're getting enough supplements or nutrients from it, you can add vitamin C, D, or even zinc preparatives in order to buttress your immunity. A for activity, exercise often. That will prevent bed sores from developing. It'll also prevent blood clots from forming in your legs, which can get to your heart and lungs and cause more problems. It'll also help your lungs to work properly. And you could include breathing exercises with stimulations in order to help get rid of secretions. There are a lot of breathing exercises on the internet, including mine, and you may find that helpful if you look at my YouTube page. In addition to this, I've also would suggest that the stimulations and vapor, and I've seen people put onions on their chest saying it's a poultice. It doesn't work as a poultice. It's the vapor that helps clear the chest. D for drugs and doctor review. Drugs like paracetamol or Panadol will help with pain relief and bring your temperature down. Medicines for sore throats would help to ease things in your throat and make it easier for you to swallow. Cough mixtures will help clear your chest. You need to speak to your doctor in order to advise you if you are diabetic and things to do. And also, your doctor will look at your blood pressure tablets to see if you're on the right tablets, which will help keep you stable during this time. Other medications your doctor can advise you, because no one knows what treatments are effective. Your doctor will have enough information to decipher which will be best for you. And it may well be that you will get better with symptomatic treatment, because most patients do well without any active treatment. I wish you all the very best.